Well, good afternoon, everyone, and welcome to VolunteerFEST 2020. My name is Brad Creighton, and I'm responsible for community engagement and events at Volunteer Fox Cities. And we're so glad that you're taking the time to watch this informational session. Whether you're watching it live or watching the recorded version, I do hope that you hear something you like from Community Blood Center and find a volunteer fit that's right for you. A couple things before we begin. I do want to let everyone know that the sessions are being recorded. So if you are watching live and do not want to be seen on the recording, that's okay. If you have a question, just leave yourself muted and type that question into the chat and the camera will not pick you up. I also want to refer everybody to the VolunteerFEST page at volunteerfoxcities.org/volunteerfest, where you can see the remaining schedule for tonight's organizations, and also visit the one-stop shop where you'll get all the stuff that you hear from Community Blood Center, as well as the other participating agencies. Well, that's enough talking for me. So I am so happy to be able to turn this over to Heather from Community Blood Center so she can tell you all about what they do and how you can help. Take it away, Heather.
Thank you so much. I appreciate it. Hi, everyone. Thanks so much for joining and watching. I'm excited to talk to you a little bit today about the Community Blood Center, what we do here, and a little bit about how you can get involved in multiple different ways. Let's get started. So a little bit about just blood donation in general and the need. Every 2 seconds, someone in this country needs blood. That means that when we are during this half-hour talk that I have with you guys, there are so many people who are in need of a transfusion. And sadly, there is no replacement for actual human blood. There's not a synthetic product that we can give to patients. It has to come from volunteer donors. So we just really strive to ask those in our communities to give up an hour of your time, provide that life-saving blood or blood product to those who need it, and you can save lives. And you get cookies at the end. So who doesn't love that? I know that's my favorite part as well. So a little bit about the Community Blood Center and where we started. So we are based here in the Fox Cities. So we have our kind of headquarter location, if you want to call it that, located on Spencer Street off of College Avenue. We began in 1955 as our nonprofit here in Appleton. That first year, we brought in 1,500 donations of blood products, which is pretty great. And this is, you can see in this image here, our first version of our mobile buses, a little different than what you would see nowadays, but wonderful in its own right. So we have grown a lot over those many years up until today. So you see in this image here, our building on Spencer Street. We have multiple locations here in the Fox Cities. We have a donor center in Little Chute, Oshkosh, and Appleton, as well as up in the Northwoods in Woodruff, Merrill, and Rhinelander. We also just began services in Chicago during this pandemic time. So that's been a really fun new adventure for us. Now we actually bring in about 60,000 units of blood product every year compared to the 1,500 we started with. So a little bit of growth in all these years. You can also see in these images a little bit of our inside look of our donor center in Appleton. So not only do you come in, give an hour of your time to give blood, but like I mentioned, the cookies, those are happening in the cafe area here at the top right of your screen. We have volunteers here in the cafe that serve refreshments and snacks to our donors, chat with them about what's going on, and just enjoy that time together. And we actually do process all of the products ourselves in our lab at Appleton as well. So as you can see on the bottom right image, one of our lab techs is going through and separating products out. We have many different tests we do on every donation that comes in to make sure that it's a really clean and safe product for those patients who need that product in the hospital. It does take about 24 hours from the time that you give blood to the time we can actually transfuse it into a patient. And that's because we do go through all that testing. So that's why it's so important that when you come in to give blood, you come back every 8 weeks and give that product as often as you can. So we really do rely on that product. So our mission is short and sweet: connect lives, share life. The Community Blood Center really does just that. So we strive on connecting the community that we serve. We don't go and collect blood product where we don't serve that local hospital. So wherever you see us actually collecting blood is where we serve a hospital. So when you give blood to the community blood center, that's going right back into your community to the hospital nearest you. So you are giving blood to your neighbor who might have an emergency, the woman down the street who's pregnant who might have a bad birth and just needs a little bit of extra blood transfusion, to the person who has cancer who needs a platelet transfusion. So lots of different reasons people need these products. And that's why it's so important to give with us, because when you give with us, it stays here with us in your own community, which is why we're called the Community Blood Center. And obviously we want to be forward-thinking industry leaders. We're one of the lowest cost providers in the country because we do serve local communities here. We're not shipping our blood all the way across the country. We're keeping it right here and keeping it local. That's what we really are proud of doing. So a little picture here for you, and I apologize, I did not get the one with Chicago on here, but rest assured we are serving Chicago. We have about 30 hospital partners that we have right now in Wisconsin and Upper Michigan. So all of that kind of brown gray area, that's where we actually do our drives. So in those service areas, we're going out for blood drives, collecting at our donor centers, and that's where we are serving those hospital partners. Every blue dot on this map is a hospital partner that we have. And all of the red logos are where our donor centers are located. So again, a really expansive area here. We kind of, we have lots of different locations. So even if you don't live right in the Fox cities here, we most likely, if you live in this shaded area, will be around you at some point every month for you to volunteer for a blood drive or donate for a blood drive as well. All right, so a little bit about the blood drive. So here's a picture of an updated bus versus the 1955 bus we saw at the beginning of the slide. A little bit different than we used to use, so a little bit of an update. We have about 100 blood drives every month, even during COVID. And about half of our donations that we get every year come from our blood drives. So it's really important that we have these going on all the time. During COVID, we've had it continuously running about 100 drives a month, just to make sure that we have that product available for all those elective surgeries and emergencies that happen. All right, it's a little bit about the process. So like I said before, it takes about an hour from start to finish. So about 15 minutes per step. Step one, you're gonna enter the building and you go to what we call registration. You check in with our wonderful staff or volunteers, you get your form, they explain that to you, you fill out that form, and then the next step is screening. So we make sure it's a very, very safe product for the patients who will receive this blood product. So we're gonna take your temperature again, we're gonna do a blood pressure cuff screening. We're gonna test your blood actually with a little finger poke for your hemoglobin and iron levels. We're gonna go through that big expansive questionnaire you filled out at the beginning of the day and make sure everything looks good on there. If you pass all of those tests, you can go on to donation. And the donation process is really not as scary as people think it is. So the total process for actually giving blood when you're actually hooked up to the machine takes roughly maybe 5 to 12 minutes tops. I've seen people donate in 4 minutes. A lot of people donate around 8 minutes. So really it's not that long that you're hooked up to the machine. And our technicians are wonderful and do a great job with doing their sticks. So you're gonna be giving some blood, hanging out with our technicians, chatting, and then after you finish giving, you get to go and have some snacks. So we have salty, sweet snacks, we have coffee, we have water and juice, lots of different things to make sure you feel well before you leave. Our volunteers at the cafe areas are gonna make sure you feel good before you leave because we don't want you driving away and not feeling well. So make sure you're feeling well and healthy before you leave us. We ask that you hang out with us at least for 5 or 10 minutes just to make sure you're feeling good before you head out. If you have any kind of issue after donation, we'll take care of you as well. So if you're not really feeling well, a little lightheaded, maybe a little nauseous, don't worry because we'll take care of you. Our technicians are trained in how to do that. So we are there to help you no matter what happens. All right, so you can save up to 3 lives from just one donation. So an hour of your time, you can save 3 people's lives, which is amazing. And again, it's in your community here. So it's people that you might know or have walked by in the grocery store, seen at church, whatever it might be. So now my call to action. How can you get involved? Obviously, you can become a donor. That's one of the biggest things that we really ask right now during this time. We really do need your blood donation. It's really important. Like I said before, there's no synthetic option for blood. Even as far as we come with technology and health, we still need blood from a donor. You can also encourage your friends and family to donate blood if you can't give yourself. You can also donate not only blood, but also platelets or plasma. If you have happened to have COVID-19 and you're recovered and feeling well, you can actually come call us, tell us about it, and we will have you come in and have you tested for those antibodies to see if you're a candidate to give plasma, which we can then create into convalescent plasma. That is then sold to our hospital partners and given to patients in the ICU and the hospital with COVID currently. So you really could be saving so many lives just by coming in here for an hour, 2 hours to donate plasma. You can like us on Facebook and other social media platforms and share our messages. You can host a blood drive, which is really fun. If you have a community group that you're part of, or your workplace wants to host a blood drive, we would love to talk to you about that. And as the volunteer program manager, I would love for you to volunteer with us. So we're going to talk a little bit about how you can become a volunteer. Okay, so just a couple things that we do ask of volunteers. We just ask you come in at least once a month. Really easy. Our shifts range from 2 to 4 hours. You can pick what times you want to come in. We're really flexible. As long as we see you at least once a month, that's what we appreciate. We also want you to commit to 3 months at least to volunteer. It does take a little bit of time for you to get used to the flow of blood drives and just to get trained in. So we ask for you at least to hang out with us for 3 months minimum. We would love to have you for 3 years, 30 years, whatever it might be, but at least 3 months to start out with. And we are going to have you go through training and orientation as well, so you feel prepared and established for your role. So a little bit about the opportunities we have available right now. We have a position for blood drive registration. This position, you just must be 18 years old at least to volunteer as a registration attendant. In this position, you'd be working at blood drives to check in our donors, explain their paperwork, and then route the donors with that completed paperwork to the screening area to make sure that they're going to the right space, helping with donor flow, making sure it's a very well orchestrated blood drive. And then we have the cafe attendant position. So cafe attendants, this needs to be at our donor centers. So you'd have to come to Little Chute, Oshkosh, or Appleton. But you can be 16 and still do this position. So you can be in high school, a younger position, it's kind of hard to find once in a while. So we do have that possibility here. You provide snacks and refreshments to our donors, just making sure the donors feel well, like we talked about before. Just talk to them politely, engage in friendly conversation. Our donors are such wonderful, giving people, and they're just it is so fun to talk to people when you're at the cafe. I was up there on Monday, and I met this gentleman who came to give plasma after having COVID-19 and found out that he's actually a pilot and he just got back from China. So fun things you learn about people that are just something you never would have guessed. So he said, his commute to work is flying, across the country to get on a plane to China. Mine is about 10 minutes, up College Avenue. So a little bit different, not as exciting, but just really awesome stories. Lots of fun stories about why people give product, whether it be a family, a connection, them personally having received a product in their lifetime. Just really great things you can learn. It's a really great way to engage with their community. So that's all I have. I want to leave some time for any questions or follow-up at all that we might have. But I just want to say thank you so much for listening today and giving us a chance at the Community Blood Center.
That's awesome. Thank you for all that information. Do have a couple things I was kind of jotting down and wondering about. What is, I know you mentioned the age requirement for like the attendance or the registration. What's the age requirement to actually donate?
Great question. So you can actually be 16 years old and give blood, as long as you have a permission slip signed by a parent. So if you're 17 or above, no permission slip needed. But if you're 16, we just need your parent to sign off that it's okay for you to give blood.
And the parent doesn't have to be there as long as that permission slip's signed, is that correct?
Correct. Yep. They can just sign it even at home that morning and send the form with their child to school for that high school blood drive or whatever they might be doing that day. If you forget your permission slip, that's fine. I mean, not fine, but we prefer you bring it with you. But if you do forget, we have extras on the bus as well. And you can actually call your parent and we can get a verbal confirmation with a staff member on the phone. So it's always, that works too.
Fantastic. So then if I am on, what would preclude me from being able to give blood? Is there like certain allergies that you won't take, or certain, like if I'm on medications, can I still give depending on what the medication is, or?
Yeah, so that's a kind of a complicated question. So there is a quite a
Right.
lengthy list. When you come in to give blood, that registration form has a whole double backside of questions you have to fill out. So one of those big questions, you have to refer to a medication deferral list. If your medication that you're currently taking is on that list, you can't give that day. There are certain things that if you take a medication you're not sure, our technicians are trained on a multitude of medications that people take, even like an Advil or a Tylenol, things like that. You can't give with certain medications. They'll know that information. They can answer those questions for you. There is some stipulations with travel history, with kind of like Zika virus and things like that. So the booklet you get with your registration paperwork goes through all of the travel information, any kind of like sexual history questions as well, medical history, shingle shots, things like that. So typically before you come in what kind of medications you're on, but bring a list with you just in case you can't remember all of them.
Okay, great. So now if you're doing a drive or at the center, is that something you have to make an appointment for, or can you walk in to donate?
Yeah, so due to COVID, we're trying to limit the number of people at one time in our space. So we do actually recommend and require an appointment. Sometimes we do have open spots on our blood drives, but I wouldn't bank on that, as we've been really good about getting donors in our appointment slots. So if you do want to go online, make an appointment, you just go to our website, communityblood.org, and you can actually make an appointment online. You can always reach out to me as well if you can't remember the email or the internet address, but I can help you get signed up for that as well. You can also call our phone number and get signed up for that. So we do require you to have an appointment, and we ask you to come right at the appointment time because we're trying to limit the number of people again in one space at one time.
Sure. Absolutely. Speaking of COVID-19, can you talk a little bit about what, other than limiting the amount of people around, can you talk about maybe what some of your other safety precautions and procedures are, both for donors and for attendant volunteers and things like that?
Definitely. So we do require all of our volunteers and staff to wear masks at all times when you volunteer. So we do require that. We also are asking all donors to wear masks. The only exception is to that mandate in the governors of Wisconsin, that mandate where it says that if you have a health condition, you're exempt. So if someone comes to the door and says that they have a health condition, they're exempt, although we are asking everyone else to wear masks while they're with us. Our technicians are wearing face shields when they're really close to other donors as well, on top of their mask. Our technicians are also wearing lab coats and gloves whenever they're with you. We did also build actual screens that come down in our buses. If you've ever been on a mobile bus before for drives, it's pretty tight quarters, even when it's not COVID-19. So our wonderful maintenance staff built these screens that actually hang from the ceiling to give a little bit of distance between the technician and the donor on the bed. So it's a little bit of a barrier there. We do also have barriers at our cafe and registration tables as well, because obviously when you're having snacks and juice, you can't wear a mask. So we do have that protection from with the volunteer and those at cafe. We're taking temperatures at the door as well to screen for any kind of fever somebody might have coming in, making sure everyone's feeling well and healthy. And again, social distancing. So we're trying to distance everybody as best we can at our cafes. We limited the number of seats in our cafe. And we have less appointments per hour to better distance our donors in the beds as well.
Excellent. Man, it sounds like you guys are doing a ton. Thanks for taking all those precautions to definitely keep
Try.
everyone safe.
Yeah, cleaning lots of different things. You know, every pen, every folder you touch, every seat you sit on is cleaned right after you get up. So we're trying to make it a very clean environment.
Excellent. Is there any certain blood type that you guys are really in need of? You could put out a call to those who might have that blood type.
Well, we always are in need of O negative. O negative is the universal donor of red blood cells. So if you have O negative, come on in. The vampires want you. So we want to get all that blood we can. But truly, we're in need of every blood type right now. So stock supplies are low, whether it be because the numbers have spiked in Wisconsin. People are a little more apprehensive to come out to blood drives in the community. We do still really need that blood. So it's and platelets and plasma as well. So our platelets only last for 7 days. They have a shelf life of 7 days, and blood is 42 days. So really important because it will go bad. We use it, but we can't keep it forever. So it's like we can't stockpile a bunch at one time. So really important to have people come out and give any type of blood.
Great. Well, Heather, thank you. One more time, do you want to highlight how someone would reach out in case they were interested in, especially doing like an attendance or a registration, but just in general, how someone would get hold of you to sign up or to learn more?
Yeah, thank you so much. Yeah. So again, my name is Heather Duval. I'm the volunteer program manager. I can be reached. My office phone is 920-560-6632. Email address is hd as in dog, uv as in Victor, all @communityblood.org. You can see it on this slide right here as well. Our website, though, again, is www.communityblood.org. So you can visit that site to visit our website for volunteer information. Our information, email address is on there as well. But feel free to go on there to get more information about volunteering, to set up a blood drive, to volunteer or to donate yourself. We want your involvement, and we're excited to meet you.
Great. Well, we are grateful and lucky to have you in our community. Thank you all for doing what you do and the way you help fill such a great need. And I just love the fact that anybody that donates their blood stays here in the community. It's not like I'm sending my blood to Arizona or something, but
Exactly.
It's staying right here, and that's great. To anybody watching, thank you as well for attending.